Welcome everyone to DocTalks. Our focus today is on your blood pressure and you, a very timely conversation in these times of high stress for so many different reasons. My name is Jeff Malmgren. I do work supporting the Primary Care Networks in Burnaby. The DocTalks are a presentation of the Burnaby Primary Care Networks. Just to let you know that this is being recorded. Is somebody recording this? We need to record it. Thank you. And the recording of this will be put up on the Burnaby PCN.ca website. So if you would like to see it, or if you would like to tell your friends and neighbors about it, it will be up there sort of in perpetuity, Burnaby PCN.ca. Also on that site, there are a number of other DocTalks as well as other resources, community resources that are available through the Burnaby Primary Care Networks and also through all of our partners, through all of the social agencies and the health providers. It's a pretty good source of information for health and wellness in Burnaby. I do want to say that this session is there will be lots of opportunity at the end of the session to if you have questions. It is a webinar, so we ask that you put the questions in the chat or in the Q&A, and we'll make sure that we get to as many of those questions as we possibly can. If we run out of time and we're unable to get to the questions, we'll do our best to find the answers and either post them on the Burnaby PCN.ca website or get them back to you directly. Maybe I can ask you, Sarah, to move to the next slide for me. So we're really lucky today to have with us Sarah Lee and June Cho, who are primary care clinical pharmacists within the Burnaby Primary Care Networks. This is a program that launched just a couple of months ago, and I think for folks who have an understanding of the value that clinical pharmacists bring, they see what a great asset it is. I hope that at the end of our presentation, you'll have a better understanding. You'll be able to see just exactly how you might be able to better utilize and this resource in our community. It's really a great thing that we have. I'm going to turn it over to Sarah and June in just one sec. Maybe we can go to the next slide. We would like to acknowledge that we're gathered today on the traditional, ancestral, and unceded territories of the Hunkaminam and the Squamish-speaking peoples. And with that, I'd welcome Sarah and June.
First? Okay, I think just June first.
Okay.
So.
Hi everyone, my name is June. I'm one of the pharmacists or clinical pharmacists that work for the Burnaby PCN. I graduated from UBC Pharmacy program. I then went through the LMPS or Lower Mainland Pharmacy Services residency program. I spent the last 10 years working in hospital, and I have extensive experience in general medicine, surgery, and oncology. And I also speak Cantonese in addition to English.
Yeah. Hi everyone, my name is Sarah. I'm also a clinical pharmacist with a similar background as June in terms of the being a UBC pharmacy graduate and completing the pharmacy residency program. Before this job, I have worked in medicine, psychiatry, and cardiology in Burnaby Hospital. So I do know this area pretty well. And my additional language I can speak is Korean.
So you may wonder, what is a primary care clinical pharmacist? And we're here to tell you a bit more about what we can do. So one of the first things that we can do for you is make sure that your medications are safe, effective, and working properly or optimally for you. We can help you manage side effects, understand changes in medications, and answer any questions about immunization, supplements, and alternative medicines. We will take the time for as many visits as needed to fully understand your needs and answer any of your health questions. And finally, you can also ask your family doctor or your nurse practitioner for a referral to our program. But to add on at the end, clinical pharmacists do not dispense or prescribe medications. So I'm just going to go through a few learning objectives for us for our talk today. First of all, we're going to learn a bit about some basics about blood pressure, what it is, and why it is important, how to measure your blood pressure. We're going to discuss what blood pressure targets we're going to be looking for. We're going to learn a bit about risk factors for developing high blood pressure and how we can change those factors. And also, we're going to explore some general medication options to treat high blood pressure.
So I guess it's my turn now. So let's meet JP. He is a 65-year-old man that we will see in a clinic who was just newly diagnosed with hypertension with a blood pressure of 150/90. And he also has a type 2 diabetes. And he's actually wondering what he can do to manage his blood pressure and stay healthy. So what is the hypertension? So persistent high blood pressure is known as hypertension. So it's a measurement of the pressure of blood within the arteries, and it's recorded as 2 numbers. So systolic for the heart contracting, and then diastolic heart relaxing. And I'll talk more about it in the next few slides. And in Canada, about a quarter of adults have high blood pressure, and about 1.4 billion people have the high blood pressure in the world, which is quite a lot of people in the world. So why do we treat the hypertension, and why do we care about it? The blood pressure is actually #1 risk factor for stroke and also heart disease. And it's the leading cause of death and disability in the world. So high blood pressure can damage the lining of your blood vessels. And then when there's a damage, it can not only cause a stroke and heart attack, but also the vision loss, heart failure, kidney disease, and also sexual dysfunction. So as you can see on this slide, there are 3 different ways to measure blood pressure normally. And you can see the one on the left might be something familiar to you. It's a home blood pressure monitor. And as you can see, the top number is systolic blood pressure, and it's the pressure in the artery that the heart contracts. And then bottom number, as I said before, is a diastolic blood pressure. It's the pressure when the heart relaxes between the heartbeats. So the home blood pressure monitor is usually the best way to measure the blood pressure that reflects your normal blood pressure, especially in the morning, the first thing in the morning. And then sometimes doctor may even ask you to do the evening blood pressure around the bedtime. And then you can see the second one in the middle, which is the manual blood pressure that doctor may do in your office. The third one is the machine that you may see in a pharmacy or a medical clinic that you can do yourself. If you don't have a blood pressure monitor at home, it can be useful. But you have to keep in mind that you do need to take ideal precautions to get the best measurements, which I will talk about in the next slide. So how do you measure the blood pressure so that it will reflect your true blood pressure? Because if you walk, talk, exercise, it's expected your blood pressure to be high. So, and high blood pressure is a persistent blood pressure that we care about that occurs even when you're resting. So it's important for you to rest for at least 5 minutes and take your blood pressure. So as you can see, first, don't have a conversation. Second, have support the arm at heart level. Put the cuff on bare arm. Use the correct cuff size. And then put both of your feet on the ground with legs uncrossed. And ideally have empty bladder with the back supported. So it's important for you to do these steps, and that is why that blood pressure first in the morning might be the most realistic option. And it's important for you to also try not to drink coffee, smoke, or drink alcohol around the time you're measuring the blood pressure. So what are the targets? And that's often the question that we ask, right? So the target slightly varies depending on your risk factors. Which June will talk about later. But for high-risk patients, usually are those with already established heart conditions, kidney issues. Those patients, the doctor may tell you to target the systolic blood pressure of less than 120. Whereas for diabetics in general, we try to target less than 130/80. And then for the rest of the people, we usually target around 140 over 90 and less. And then the next question is, how often should we measure the blood pressure? So the adults who have normal blood pressure and doesn't have the heart disease risk factors, usually every 2 to 5 years of measurement is recommended. But those over 40 years old and with a high risk of blood pressure, then once a year is recommended. And then more often for those with chronic health conditions or heart disease. And you can always ask your doctor how often you should measure the blood pressure.
Okay, so going back to JP. JP has measured his blood pressure at home and he found that it's actually 145 over 90, which isn't as high as in the office. But as what Sarah mentioned earlier, a lot of things could have happened. He could have been anxious while he was in the doctor's office. He could have had a cup of coffee. There could have been a lot of things that could have made that difference. But at 145 over 90 and the fact that he's over 60, it's still enough to start treatment. So he wanted to have a discussion about whether or not he should start medications or should he start lifestyle changes. JP then decided he would like to make some lifestyle changes first. So making changes at home are things that we can look at are risk factors. And what is a risk factor? So a risk factor essentially is things about yourself that can increase your chances of developing a condition. And in this case, we are talking about hypertension or high blood pressure. There are two types of risk factors that we think about with hypertension, things that are modifiable, things that we can change about ourselves, and non-modifiable risk factors, things that we cannot change about ourselves. So we'll go through some non-modifiable risk factors first. So as you can see in this picture, there's 4 main ones that we can think about: sex, age, family history, and ethnicity. Ethnicity-wise, in Canada, Indigenous peoples, people of South Asian descent, and people of African descent, and also individuals with low socioeconomic status are at a higher risk of developing high blood pressure. Sex, generally men have higher blood pressure than women, but as women age, we actually have a higher risk of developing blood pressure than men, which then brings us to age. Under the age of 64, men are actually at a higher risk, or there's more prevalence of high blood pressure in men. But as we go past that age, women are actually more likely to develop high blood pressure. And finally, family history. If you have a family history of high blood pressure, it is definitely a risk factor for you to also develop high blood pressure. And when we're talking about family history, we're talking not about our uncles or our cousins. We're more talking about arm's length, so mom or dad. What are some modifiable risk factors? So some things that we can change to help decrease our risk of developing high blood pressure, or help decrease our blood pressure overall. So some things that we can do are physical activity or exercising, weight control if we're overweight, controlling our diet, specifically trying to limit our salt intake. Smoking is another risk factor that we can address. Alcohol use, and finally, stress. Going into a bit more detail, smoking cessation can actually reduce the risk of developing cardiovascular disease. And in BC, if you or a family member is trying to quit smoking, there's actually a couple of options for you. So the BC government actually covers for 12 weeks out of the year 100% of the cost of nicotine replacement therapy, so including patches, gum, lozenges, inhalers. And then there's also prescription medications that can be used to help in your journey of smoking cessation, and those are pharmacare benefits. And the coverage on how much it gets covered will depend on your deductible. And again, it is covered for 12 weeks. And finally, quitnow.ca is actually a program delivered by BC Lung Foundation on behalf of the BC government, and it provides support to individuals who are thinking about or trying to quit smoking. If you have any questions about any of the programs that I talked about today, you can speak with your doctor or any community pharmacist. Exercise. So regular physical activity makes your heart stronger. Your heart is a muscle. Exercising makes that muscle stronger. And a stronger heart can pump more blood with less effort. And with less effort on your arteries, this helps to lower blood pressure. We usually generally recommend about 150 minutes per week of moderate aerobic physical activity. And essentially what that means is enough to increase your heart rate and break a sweat. The type of activity that you might think about when you're thinking about exercising could be jogging, cycling, brisk walking, doing stairs, active sports. The type of activity is really up to you. And again, the bottom line is just trying to increase your heart rate and break a sweat. And also we try to space out our days of activity throughout the week, and also trying to maintain about 30 to 45 minutes each time. Next, a bit about your diet, specifically salt intake. So salt holds on to water, and more water in our body means higher blood pressure. So cutting back on salt in your diet is one of the ways that you can, one of the things that you can change to help decrease your blood pressure. So how do we know how much salt is in something? We can look at the nutrition labels. Those are usually either on the back or on the side of food containers. General rule of thumb, we recommend buying products that are labeled with less than 5% of your daily recommended intake of sodium per serving. And to lower your blood pressure, we aim to limit our salt intake to less than 2,000 milligrams per day, or 2 grams. And some of the foods that, another way, I guess, to help limit salt in our diet is to watch out for what we call the salty 6. These are a few of the foods to be aware of and think about if you would like to limit salt in your diet. Breads and rolls, generally we wouldn't think that there's a lot of sodium in them. Individually, yes, but as our servings grow out throughout the day, there is more and more salt built up, essentially, throughout the day. The toppings on a pizza are really where the sodium is, such as pepperoni, sausage, and the different types of toppings can really make a difference in how much salt or sodium is in that one slice of pizza. Next, sandwiches or burgers from fast food restaurants can sometimes actually contain more than 100% of the recommended daily intake of salt. So just some food for thought. Cured meats, deli meats contain a lot of salt because of the way it's made, because salt helps to dry out the meat, helps to process it. Canned soups is another one. They're very high in sodium in general, but there are now a lot of varieties where they have a low sodium option. And finally, burritos and tacos, similarly to pizza, it's really all in the toppings and the things that you put in it. If you have like highly processed meats or lots of seasonings, that can definitely increase your salt intake. In general, making more of your own meals can give you better control and a better idea of how much salt you're actually taking in with each meal. And then finally, managing your stress. So essentially here are some tips to help manage your stress. Learning some relaxation techniques such as meditation or breathing exercises. Setting realistic goals for yourself. Know your limits and try to remind yourself that it's okay to say no once in a while. And essentially prioritize what you want to do and what are some of the things that you just have to let go of. Exercise. Other than what I had mentioned earlier about exercise can also help ease tension and improve sleep and self-esteem. Developing some hobbies, It's a great way to kind of connect with yourself and kind of taking time to enjoy yourself. Maintaining a healthy lifestyle, having a good diet, and exercising. Essentially, some of the things I've already mentioned will help manage stress. And then finally, talk about it. Talk about some troubles with your friends or with your doctor if you feel that that is contributing to your daily stress.
So the next step is for JP. So despite JP's efforts to eat less salt and exercise, as June recommended, his blood pressure unfortunately remained high. And unfortunately for some people, lifestyle changes might not be sufficient despite doing everything right. And it still helps, it's just not enough. So JP meets with pharmacists to talk about medication options. So what are the medication options? So here, I know this slide can be a little bit busy, but here are the most common medications used for the high blood pressure. And you can see on the left side, there are the classes of medications. So there are diuretics, ACE inhibitors, ARB, calcium channel blocker, and beta blockers. So you may have heard some of these terms from your doctor or pharmacist. And then there is the list of medications on the right, that's generic, and then the brand names. Sometimes people say one interchangeable to another. So we have both in there for you. And these are some common medications, and doctor may prescribe you one particular medications depending on your medical condition and also your medications you're on. For example, ACE inhibitors and ARBs are preferred agents for patients with diabetes because it has some kidney protecting effect. But at the same time, for some people with lower kidney function, the doctor may even stop the medications too, depending on your situation. So it's very important for you to talk to your doctor to see what is the most suitable medications for you. And also, if you have any concerns with side effects and management, also you can talk to us, pharmacists. And in other cases, you may notice that you're on more than one medications, and that is common for some people because one agent may not be enough to lower the blood pressure. So you may need to be on 1, 2, or 3. Or for some people, it's not just for the blood pressure, but for other conditions like heart conditions that they may need to be on multiple. And for some people, they might have side effect from one medication, so they need to be switched to another medication class. Yeah, so there are so many different cases and situations why doctor may choose one over another for you. So it's very important to have the conversation if you have any questions and concerns. So what are the side effects? Because those are the things that you wonder, right? So in general, blood pressure medications are generally well tolerated, but you may experience some side effects. Most commonly, for most blood pressure medications, you may experience the lightheadedness and dizziness. And that is because when you stand up too fast, especially, it takes time for your body to pump the blood into your brain because of the gravity. And because of the lack of sensation of the blood in your head, you may feel lightheaded and dizzy. So it's very important for you to stand up slowly when you're on the blood pressure pills because they lower the blood pressure. So it takes longer for your body to have enough pressure to pump the blood into your head, which eventually happens, just not as fast. So stand up slowly. And if you feel dizzy, make sure you hold on to something so that you don't fall, because falling is very dangerous. And then for some medications like beta blockers, you may have some fatigue or sexual dysfunction. Something like fatigue, it can go away after being on the medication for a few weeks. And dry cough is notable with especially ACE inhibitors. That just doesn't seem to go away despite you not having any other flu or cold, whatnot. So if that's a concern, definitely do talk to a pharmacist or doctor. And leg swelling can occur, especially with amlodipine in a calcium channel blocker class. And then sensitivity to the sun can occur, especially with things, diuretics like hydrochlorothiazide. So it's important to wear sunscreen in the summer so that you're not as sensitive to the sun for sunburn. So let's go back to JP. So he was started on Ramipril 5 milligram a day, which is in a class of ACE inhibitors. And after a few weeks, he started developing dry cough, and we couldn't find any cause like cough, cold, flu, or allergies. So JP came to the pharmacist and then had a discussion and found out that Ramipril can cause dry cough. So with the pharmacist's recommendation, the doctor changed his medication to candesartan, which is in the ARB class of medication that has lower risk of dry cough. So now he had no more side effects with a new medication, and his blood pressure is now 130/80, which is right on the target.
So, in summary, high blood pressure is one of the leading causes of death and disability in the world. In general, a good target for your blood pressure is less than 140/90, but it will depend on things such as other medical conditions that you may have. It's important to check your blood pressure regularly, especially if you have a diagnosis of high blood pressure. Try to focus on lifestyle changes to help decrease your blood pressure. On top of helping you decrease your blood pressure, as Sarah and I mentioned earlier, sometimes lifestyle changes aren't going to be enough. This will actually help decrease the amount of medication that you may need to treat your blood pressure. And finally, there are a lot of medications to help treat your blood pressure, and it's important to speak to your pharmacist if you have any questions or any concerns. And this is a page, or rather, these are some useful resources for you if you would like to learn a bit more about what we have discussed here with you today.
And lastly, if you want to know a little bit more about the Burnaby Primary Care Network program, you can go to the website at www.burnabypcn.ca. And if you want to know more about our service as a clinical pharmacist at PCN, there is a section under the allied health with the pharmacist information. And just so you know that we are a bit different from the typical pharmacy you will see in a community, in a chain pharmacy, because we do not do any dispensing of medications. We are here to spend the time to talk to you about medications, especially if you're on multiple medications and you're also on other natural products or over-the-counter products and you have questions on that. You can access us through the referral from your family doctor in Burnaby. Yeah. So
thank you. I think it's back to Jeff.
That's great.
Jeff.
Oh, that's wonderful. Thank you. Thank you. It was such a great presentation. And, you know, I know that you didn't mean to use my name, but now I'm wondering if I have high blood pressure. So I'll definitely try to check that out, because I'm probably at that age where I need to do that. So that's good advice for me. There are some questions, and folks, I will remind folks, if you do have a question, put it in the chat or in the Q&A, and we'll make sure that we get to it. We've got a little bit of time, but I do have some questions. One of them that came up for me was around exercise. I mean, I know, and it's obviously it's a way to mitigate high blood pressure. Is there a concern if I've been diagnosed as having hypertension around the amount of exercise I get? Am I putting myself at any risk or as I start an exercise regimen?
Yeah, so when we talk about exercise and kind of in the treatment, or rather the modifying of our blood pressure, we definitely want to do that under the advisement of a professional. So specifically, it would be your NP, your nurse practitioner, or your family doctor. Usually, depending on what your fitness level was before you were diagnosed, will kind of dictate or kind of steer you in the direction of what kind of activities the doctor would want you to start with. If you were mostly sedentary, or anybody was mostly sedentary, we wouldn't tell you to go run 5 miles. We would definitely tell you to start somewhere along the lines of maybe take a brisk walk around the block and then kind of work your way up, because like you were mentioning, it can have the opposite effect if we're trying to push ourselves too much.
Yeah, and you can
increasing our blood pressure.
One of the reasons that high blood pressure is bad is it puts you at risk, right?
Yeah, so it's kind of like it's a double-edged sword sometimes if we think about it that way.
Is that true about diet as well? In other words, is this a drastic shift in diet? Does that create any issue around stress or metabolic change if you make a significant or drastic change? Because I know that kind of the things you talk about is like, oh yeah, bread, I eat bread. And most of us, and some of us have very high salt diets that we don't realize we have high salt diets. As you really pointed out, there's a lot of salt in our world. But if we make a drastic change, does that have risk, or is it a different situation?
Do you want to answer, or
do you have the answer? Or?
Yeah, I kind of do in my head. So generally, we wouldn't say that diet is one of the things that we would worry too much about. If again we're doing everything in moderation. Again, like that slide was kind of just to kind of point out some common foods that we eat that we don't really think about having a lot of salt. And again, everything is in moderation. We don't try to cut out any specific food groups. It's trying to limit that salt, which is the most kind of the biggest culprit in terms of causing high blood pressure because it holds on to water so well. So I'm not saying don't eat bread, but just be cognizant or be aware that there is sodium in it, even though we're not thinking about it. And again, maybe stay away from the fast food burgers, We don't want to use all of our salt quota in one burger.
And also, I mean, some people have that lifestyle, so your palate and tongue get used to the salt. So if you're already eating so much salt to begin with, it's hard to cut back and everything will taste bland, right? So and then if you cut the salt entirely, for some people that's really hard and they just go back to it, right? So it's important to be more consistent, and if you wanna, and then also set measurable and also realistic goals that you can do. And for some people, just cutting it a little bit by little, gradually works for some people. For some people, they just cutting more, like in half, might be something that works for them, and that's how they work. So it really depends on the person. And if you have any concerns about that, definitely talk to your family doctor or an NP. And in terms of, I just wanted to add with the exercise, moderation to what you feel comfortable is important. If you go beyond and you just don't feel well, that's not what you want. And especially if you have chest pain or don't feel good, then definitely talk to your NP and your family physician, because we really do not want you to have any kind of chest pain when you do exercises.
Right. That's a good indicator to stop.
Yeah. So again, general rule of thumb, just enough to break that little bit of sweat and kind of get your heart rate up a little.
Great. And then you're doing well. There's a question around age, and I'm wondering about it as well. The question was, does everybody eventually have high blood pressure as they age? In other words, does your blood pressure naturally go higher as you age? And do the targets shift as you age? Does that make sense?
Yeah.
Yeah, it's really, really good question. I think it's something that people wonder about, and patients will come and tell us, I live really healthy lifestyle, I exercise, I did that good diet, I still have hypertension, like high blood pressure, right? So it is true that with age that your risk of high blood pressure goes up. And actually, one of the criteria for high-risk patients is actually age 75 or more in our guideline, actually. So with age, yes, the blood pressure can go up, but doesn't mean that the blood pressure target will be 100 over 120 or less for everyone. Because with your age, you also may be more frail, you may be more dizzy, you may be more at risk of falls, right? So the target will be really dependent on how you're functioning, how you're doing. So I guess answering your question, first is that yes, the age increases your risk of high blood pressure. Second, the target will depend on your function and your other medical conditions. And and then it's important for you to talk to your personalized target with your physician or nurse practitioner. Does that make sense?
Yeah, absolutely. So I mean, it's. I think that is it. You really answered the question. Is guidelines are guidelines, and everybody's circumstance is different, and so you have to make sure that you're not just reading this off the internet and reacting to it, sort of thing. It's there's a conversation that's to be had. I sort of along the same lines, and going back to the exercise question. So is there, and I know that this is sort of if you find you have hypertension, but is there any evidence to show that that you're better off to actually stay in good shape than to try to get, or to stay inactive rather than try to get active in terms of avoiding hypertension? Or does that make sense? So, I mean, if I were an active person, and I stayed active, would I have a lower likelihood of getting hypertension eventually?
Yeah, so I guess it's kind of, again, exercising and being healthy, I guess, is one of what we were mentioning early is our modifiable risk factors. So staying healthy to begin with will definitely have lowered that as a risk factor than somebody who, say, was leading a fairly sedentary lifestyle.
Right. Yeah.
Right?
Yeah.
So, I mean, but at the same time, I'm not saying that we shouldn't get active if we were leading a sedentary lifestyle, because that is still one of the risk factors that we can change about ourselves, right?
Yeah.
Going out for that walk for that 10 minutes a day, for 30 minutes a day, that like every little bit really does help.
It's never too late to get fitter.
Yeah.
Right.
And also keep in mind that there are other risk factors and other factors that also affect your risk for developing high blood pressure, right? So, it's even if you work out and exercise consistently, there are many other factors, diet, smoking, alcohol, stress, that can all affect your blood pressure, right? And then there goes also the non-modifiable risk factors, right? If your parents have high blood pressure, you have a very high chance of developing that, right? Regardless of your exercise status. It's important to remember that there are many other factors that affect your health, not just one.
So this kind of links to this question just a little bit. There's a question around when you move to that place where you're actually getting medication. Is that, I mean, for many people, particularly seniors, it seems as if that's a medication they're on for the rest of their lives. Does that need to be the case, and is it dangerous to want to step away from medication? What's the impact of actually stopping medication?
That is a question with not a straightforward answer, unfortunately. Generally, we would say that, yes, like this medication would be something that we would be considering chronic or long-term, because hypertension or high blood pressure is what we call a chronic condition. So once you have high blood pressure and your blood vessels have kind of like become a little bit more kind of stiff, so to speak, and your blood pressure is already high, and you've made all those lifestyle measures or lifestyle changes, that blood pressure is more likely than not to stay on the higher side. Not to say that that can't change, again, because, again, like I said, not a straightforward answer. There is a chance that, your blood pressure does come back down, and then in which case, your medication should be reassessed by your doctor or your pharmacist. And then also some people, like Sarah was mentioning, as we get older, we might become more frail or more prone to being dizzy. And if, let's just say I'm already on, or my patient is already on the lowest dose possible of a medication, and they're still dizzy, then we have to start asking the question, is it worth it? Because if she's dizzy and she falls, that's a bigger problem than her blood pressure being a little bit on the higher side. So there, like Sarah had mentioned, with the targets and with the medications, there's always a discussion on what you as a patient are comfortable with and what you want to do. Because again, we're treating you, right? So we don't want to tell you what to do. We want you to be part of that decision.
Yeah, and we do not recommend like stopping all your medications just cold turkey. Some medications you may need to kind of lower it a little by little, like some doses, especially something like beta blockers. That if you stop it cold turkey, you may not feel that great. So it's important to have that conversation with the doctor about your medication regimen. And then have that conversation. I think it's a very valid concerns. And as you age, your risk of blood pressure, higher blood pressure increases. But at the same time, you may not be eating as much, or drinking, or you may have quit smoking that can also affect your blood pressure. So it's really a person dependent. Yeah.
Okay. So there are some sort of more clinical questions that I'll ask you, and I don't know if you can answer these or not. But why does myocarditis cause high blood pressure?
Oh, I would say that. Well, it's hard to say because I don't know the actual answer. I can definitely take a stab at it, but I don't know if that's
fair framing. Yeah. We won't count on it, but yeah, but you have some experience behind it, so that'd be great.
I mean, so you're saying myocardial infarction causes hypertension?
That's what they're suggesting. Yeah.
Myocarditis. Oh, not yet. Okay, not myocardial infarction. Myocarditis.
Yes.
And are we talking about myocarditis causing hypertension long term or in the short term?
It does not say. I'm sorry, I don't have the answer to that. You could answer either way.
So myocarditis is essentially myo being like your heart, and then like your muscle, and then carditis kind of like your heart. So it's like your heart muscle is in pain or inflamed, inflamed and in pain. So pain in general will shoot up our blood pressure. So if you were to take a blood pressure of somebody in any kind of acute or sudden pain, you will notice that their blood pressure is going to be significantly higher. So I can see that causing an immediate effect on blood pressure, but I can't really think of why or how it could cause high blood pressure or hypertension in the long-term situation.
Yeah, I mean, myocarditis is also occurs. The causes of it is so much varied. It can be many other causes, so it's hard for us to say specifically what it is, because especially there are many other causes, right? It also depends on the cause of the heart inflammation. So I think for that question, I think it's best to talk to the doctor and have that discussion, because there may be something else that's going on too, right? So it's hard for us to answer without really knowing you as a patient. More history,
yeah. And I think that as I say, these clinical questions, it's not that makes total sense. If you can answer them, great, and if you don't, it's. But the next one is around AFib. Does AFib have any impact on blood pressure?
So atrial fibrillation. Are we talking a little bit more nitty-gritty details?
Yeah.
So atrial fibrillation, if you don't know, atrial fibrillation, our hearts have 4 chambers split into like kind of upper and lower. Atria is the top part and the bottom part of the ventricles. The atrial fibrillation is when your top part of your heart is like beating a lot faster than the bottom part of your heart. That's why it's fibrillating. And for some patients or people who are in active atrial fibrillation and uncontrolled, where the heart rate is significantly higher than say 100 or 120, your blood pressure can actually decrease because your heart is actually not pumping in its optimal rhythm or function. So that's why a lot of patients, if they are in uncontrolled AFib, they can feel it because they're dizzy and they're short of breath and they're lightheaded. In terms of whether or not it increases blood pressure, that's not usually something that it causes, but it can be associated with it because you do have heart disease in general.
Yeah, and really that was the question, does it have any impact? And I think you answered that really well. There's just because of the mechanism, it is likely to have an impact, and the impact will be a drop in blood pressure. And so I would imagine if you go to a doctor and say, you're feeling dizzy, and they might first think about, oh, is this AFib? They might look at that as a potential cause.
Yeah, and you may, I guess, there is, I guess I'll show you the medication. So if you have atrial fibrillation, there are medications that help with it. One is a medication that can help with rhythm, and then also the other one is helping with the rate. So you may actually see one of these medications, calcium channel blocker or beta blocker, being used. So that can be used not only for high blood pressure, but also for atrial fibrillation too.
Great.
So just something to keep.
They could be similar. Yeah, these drugs are, like a lot of drugs. They have a variety of different indications, which leads nicely. I mean, you talked a little bit about one of the things that you can support people with is understanding how their various medications will interact with one another. There's a question around vitamin therapy, and I think that there's a couple of questions here. I mean, is there vitamin therapy that will support high blood pressure, hypertension? That's one question. And then the other question is around interactivity of vitamins. And is that something that people should be worried about, and should they be talking to you about it?
So vitamin therapy, are they talking about like just oral, like, vitamin D or C daily, or are they talking about like vitamin IV therapy?
Well, I think it's either one. I think the first question is there a vitamin therapy, regardless of what type it might be, that would be beneficial or for someone with hypertension? And then the second one is really just ensuring that there are counterindications around vitamins and mixing with some of these medications.
Vitamins in general, so like as far as I know, I'm not aware of any vitamins IV or oral that actually helps with lowering the blood pressure. There are lots of claims around it, but as far as I know, there's no actual like a scientific study that shows that it has impact on it. But you have to remember that the whole point of treating for lower blood pressure is not just looking at the numbers, right? We're actually trying to prevent stroke, vision loss, heart attack, heart failure, kidney disease, right? So lowering blood pressure is one thing, but we also want to prevent all these things from happening, right? So as far as I know, I'm not sure about I don't think so. If I ever encounter it, I can definitely mention in the future, but I don't think so. But vitamins in general, if you take it orally within a reasonable amount that's recommended in your bottles, it should be pretty safe. So like vitamin C, D, within that amount is okay. Vitamin D is actually recommended not for hypertension, high blood pressure, but it is recommended in Canada to take it, especially in the winter month, because in the winter, we don't really get exposure to the sun, which helps us develop vitamin D that helps increase the calcium absorption in your body. So that way, they do recommend vitamin D, but not related to the high blood pressure. Do you have anything to add?
Yeah, so I guess answering the second question about the interactions, generally, vitamins are, like Sarah mentioned, they are fairly safe and mostly benign in the recommended daily intake amounts that are recommended by Health Canada. There are theoretical interactions with some vitamins, with some medications that we use, not specifically with blood pressure medications, but other medications that are used in heart disease that, again, are theoretical interactions. So it's always the best thing to do is make sure that before you start any kind of supplement, any kind of vitamin, anything over the counter, really, anything that doesn't require a doctor prescription, to talk to either your pharmacist or your doctor to make sure that there isn't that potential interaction and that potential negative effect.
Great. And thank you. And I think that's so just a quick follow up to that, because, and as Sarah mentioned it, it's, there are lots of people who make claims like any other chronic disease or chronic condition we have, whether it's, baldness or stomach issues or whatever. There are an awful lot of claims out there of products that we can buy on, particularly online, that will cure all that for us. Is it reasonable for folks to be able to come and talk to you about those things if they're thinking about trying something, whether it's an herbal remedy and so that you can give them can you give advice on those kind of things?
Yeah, so if you're on, so our service is through the referral from family physicians or nurse practitioners. So if you're on multiple medications, or you want to start the natural product or over the counter and you're not sure, that's definitely, we'll love to see you. You just need to request a referral to us from your family doctor or nurse practitioner. But if you're only like on one medications or few, or you just have very specific questions and you want the answer right away, your community pharmacist will be the easy access for that question that can be addressed right away.
Great. So I just have that, and we're at time, but just on that, and I'm afraid I have to ask this question just because of where we are in the world. What happens if I don't have a family doctor or an NP?
In terms of talking to us, or
in terms of referral or talking to us, or even getting this information, getting this kind of support. Is there another avenue? Can I access through the I don't know, Veronica, can you speak to this? Can I access this through the UPCCs that are opening? Is there a referral process through the UPCCs?
I think Veronica might be the better person to talk about it.
Yeah.
Thanks everyone. Certainly we are excited to see that at the Metrotown UPCC that opened earlier this month, there will be a clinical pharmacist there as well. So different primary care needs can be supported through the UPCC, and you can self-refer. And if the need relates to seeing a clinical pharmacist, they should be able to set you up with that. They've just rolled out their services this month, and I know they're still doing some hiring, so it might take a little bit, but that's definitely one avenue. If you don't have a family doctor, that you will be able to connect with the clinical pharmacist. And I think, as June and Sarah mentioned, clinical pharmacists are really great for complex conditions when you're on multiple medications, sifting through your history, different medical records, different practitioners you've been with, and kind of sorting through all that and helping you navigate with the care practitioner how to move forward. But for immediate questions, the community pharmacists are a great place to go.
Excellent. Well, thank you. And I was going to ask you to put this slide back up, so that's wonderful. I really want to thank Jane and Sarah for the presentation. Really valuable, really appreciated. And I think I will say, I think and Veronica's alluded to it, it's tip of the iceberg as to the kind of support that a clinical pharmacist can offer. So I hope that it's been valuable for you as you watch this presentation. Again, it will be made available on the BurnabyPCN.ca website. So you'll be able to see this video, and as well, if you have any questions, you probably responded to a link on this you can certainly send your questions through, and we'll make sure that we get them to Jane and Sarah and get answers to you as we can. Anything further before we go? Any last words from you guys before we go?
No, I think we're good. Thanks for attending our talk. And we really appreciate all these great questions that the high quality questions that you guys asked. So yeah, thanks for this opportunity.
Yeah,
Great.
thank you so much.
Thank you. Thanks everybody, and we'll see you all soon. And go enjoy the sunshine. There's vitamin D in that stuff.